Hi guys, welcome back to my YouTube channel. In case you're new here, hi, my name is Christine and thank you so much for clicking this video. Actually, if you've not subscribed, what are you waiting for? Because I know you're going to watch this video and then you're going to click on another one and then watch. I'm so sorry about that. And watch again. So please subscribe, it's free and you can always get notified every time I upload a video. Wow, such a long introduction, but anyway. So as the topic suggests, we're going to talk about 5 things I wish I knew before getting into this course. Yeah. So I know I was always passionate about nursing. Yeah, but I didn't expect it to be this intense. I think I've been saying that since I started this series, and yeah, I didn't think it would be that intense. But man, if you're dealing with people's life, just buckle up. You have to. You have to. Yeah. So lesson number 1 that I learned is always ask, even if the thing that you're going to do looks so like you have to use your common sense. Just ask because you're dealing with someone's life here, and yeah, it can be a little bit risky and you can be at fault. You can be on the other side. Yeah, very quick. Yeah, so always just ask. Just ask. Even if you feel stupid, just ask. Yeah. Lesson number 2 that I learned is that you have to be very fast. Like in terms of thinking, in terms of doing things, you have to be very fast because mostly at the emergency level, my friend, you just have to be on pace. Like I remember when I had a shift in the emergency section. Wow, section. You could even go for like from morning to evening. You have not sat down. You have not, like, you're not in one place. You're always walking from here to there, back and forth, back and forth. So you have to be fast. Yeah. The other thing that I learned is that when you tell someone that you are a caregiver or a nurse aide, nurse assistant, healthcare assistant, all people think around that is just the dirty work, like dealing with soiled things, dealing with old people, dealing with blood, dealing with poop, urine, and all that stuff. It's not all about that. It's something deeper. Yeah, yes, you'll do that part, but it's not like the main thing. You get me? Yeah. So it's not all about just that. Yeah. Another thing that I learned um, while I was on attachment is that things can things move really quick. Like things can go from 0 to 100 very quickly. Like this was a patient that you were working with, you were laughing with, you just took him to the X-ray, and right now, like 5 minutes later, you just sent maybe to the reception or somewhere else or to the laundry, and when you come back, this person is not there. Like things go really quick, like 0 to 100, very quick. Yeah. So another thing I learned, which is in connection to that, you should be empathetic healthcare assistant and not sympathetic. I, I guess you get what I mean. Empathetic and not sympathetic. At first, I was so sympathetic, like, let me explain in Kiswahili, kusikilia mtu huruma. Like, I came to learn that in the healthcare environment, ukisikilia mtu huruma, like, you can't help them. Yeah, so you have to have empathy and not sympathy. Yeah. I think I'll put the meaning of empathy and sympathy somewhere here. So that's what I learned. Another thing that is connected to that also is that you should not get emotionally attached to a patient. You get me? The patient might like you, he or she might choose you over another person to do stuff for him or her, but don't get emotionally attached. Like, have limits. Like, your emotions should have limits. Be kind, be nice, be smiley. Like, do your job as perfect as possible, but don't get attached because it affects you when this person goes, when this person maybe dies. It will just shift a lot of emotions in you. Yeah. The other thing that I learned during my program, which helped me, is that be the nurse's shadow. Ask them questions. They might be moody and all that stuff, but ask them questions. They like, you see, nurses are, I think nurses have the most work in the hospital, because mostly bedside nurses, because they're always there with the patient almost the whole day, and then at night there's also another nurse. So they get to be so busy, and then maybe they look like you can't approach them, but always ask questions. They always answer. Yeah. What else did I learn? Yeah, I think that's that. I learned a couple of things, but those are the main like key points that I learned, and that made me to be, I think, the best I could in my attachment. Yeah. So yeah, just do your work diligently. I know, for me personally, I'm so passionate about it, because I mean, it feels so nice seeing someone who came like they were helpless, they were not breathing well, they were uncomfortable, but now you're seeing this person is feeling nice and they're getting discharged. Like there's a joy that comes from within, like seeing this person, wow, you can now walk, you can now talk, and you saw this person at his lowest and you can now see him at his best. On the other side, there's also the vice versa part, where you see someone from who came with maybe um, while walking, and then at the end of the day they get out of there being wheeled to the morgue. It's so sad, it's so draining. Yeah. So I remember my first time, it was so, I didn't know how to feel, but I was not, yeah, emotionally attached or something, but I didn't know how to feel, because maybe this is someone I just watched like 30 minutes ago, 10 minutes ago, and then when you come back, they are normal. Yeah, that's just the hardest part. Yeah, so other than that, I'll keep on updating you guys. Those who are still asking me questions, thank you so much. Actually, I've opened up forum on IG on the same caregiver series. So you just pop in there, ask your question, I'll answer um, either publicly or individually. So yeah, thank you so much for watching. Make sure you like, or you click the like button, subscribe, share to your friends, share to your daughters, to your sons. Actually, the program is not only for women. There are also men who are doing this course, and yeah, they are thriving, really thriving. So yeah, that's that. Thank you so much for watching, and yeah, I'll see you on my next video. Bye bye.